Hi, my name is Vito DeBona. I'm a health services statistician at the State Center for Health Statistics. Today, I'll be describing aspects of the data collection, management, and analysis for the Healthy North Carolina indicator tracking infant mortality among resident births in North Carolina. So, how are we doing? The infant mortality rate in North Carolina was 6.8 per 1,000 live births in 2019. Significant disparities exist for African American and American Indian women who have much higher infant mortality rates compared to other racial and ethnic groups. The infant mortality rate for African American and American Indian women in North Carolina was 12.5 and 12.0 deaths per 1,000 live births, respectively, compared to 4.7 infant deaths per 1,000 live births for white women and 5.6 infant deaths per 1,000 live births for Hispanic women. Infant mortality occurs more often for babies born to mothers who are experiencing poverty, are uninsured, and who are undocumented immigrants without access to Medicaid. The disparity ratio between the infant mortality rates for white women and black women is 2.5 and has been increasing over the past decade. The 2030 goals are to reduce the infant mortality rate to 6.0 infant deaths per 1,000 live births overall, and to reduce the black-white disparity ratio to 1.5. We can see that there are geographic differences in infant mortality rates across the state. We can also see from this graph how the infant mortality rate for various race and ethnic groups has varied over a 20-year period. We know that the rate has been dropping slowly, too slowly, over the past 2 decades, and there's more work to do. So why is this indicator important? Infant mortality is an indicator of maternal and child health and reflects health equity of a community. Results for this indicator are computed as the number of infant deaths divided by the number of resident births occurring during a calendar year and multiplied by 1,000. In 2019, there were 6.8 infant deaths per 1,000 live births. There are differences in infant mortality rates by race ethnic groups, with 4.7 deaths per 1,000 live births of non-Hispanic white mothers, compared to 12.5 deaths per 1,000 live births for non-Hispanic African American babies. The statewide infant mortality rate for 2019 is calculated as the number of resident infant deaths in North Carolina occurring during 2019 divided by the number of resident live births. And this data can be disaggregated by race, as we've seen, county, and perinatal care region. And there are the definitions of the numerator and the denominator written out there. The disparity ratio is the ratio of the non-Hispanic African American rate to that for non-Hispanic white rate. In 2019, the disparity ratio was 2.47. Data are produced annually using counts of resident birth data and death certificate data. The data are available by accessing annual data tables online from the North Carolina State Center for Health Statistics website. The infant mortality rate indicator is a period rate calculated from vital records, providing both infant mortality frequencies and rates. The disparity ratio indicator is a ratio of the non-Hispanic black to the non-Hispanic white infant mortality rates, calculated by aggregating 5 years of data. There are some limitations. Infant mortality rate data are 1 year old when presented, and disparity ratio data are calculated using 5-year rates, making it unlikely to detect modest year-to-year changes, even when they truly exist. For more information, you can reach out to me directly, Vito DeBona, Health Services Statistician at the State Center for Health Statistics, and my email is there on the slide. Thank you.